A really important aspect of elephant care is footwork. They carry a lot of weight on their feet, and so it's really important we do weekly pedicures, and then also it's best practice to take at least annual x-rays of their toes and their feet. So last November when we did Edie's annual x-rays, we noticed a little bit of arthritis in her left carpus on her front foot. So the vet and I decided that it would probably be really good to monitor her x-rays, move it up and do it twice a year instead of just the once a year. So, so we went ahead and did that. We noticed Edie would pick up her front left foot and hold it off of the ground periodically throughout the day. Because we've worked with her, we know what her normal behavior is. We knew that that was not normal. That arthritic change in the carpus, we decided to go ahead and put her on some ibuprofen every day. So to give her a little bit of anti-inflammatory relief. It is an 800 milligram tablet, and she gets 21 of those twice a day. So it is, you know, she weighs 9,000 pounds, so it is a large dose for a large animal. And for her ibuprofen, we put it in a peanut butter sandwich. So that's really good. And we do train the elephants to take oral medication voluntarily, where we can pour it into her trunk, and then she will put them in her mouth and swallow it, and then open her mouth and show us that the pills are gone, and then we reward her for that. Noticed that she was starting to hold her front left foot up off the ground periodically throughout the day again, so we were suspecting that something's changed, maybe it's hurting a little bit more. So before we changed any sort of medication with her, we wanted to redo the x-rays, see if there were any changes, and then we went ahead after we did the x-rays and did a laser therapy. She just presented her foot just like we do with the x-rays, and then for about 5 minutes our veterinarian moved the wand all around her wrist and then did the laser application. From here we're going to do laser therapy once a week for the next 3 weeks, so it'll be a total of a 4-week treatment, and then we'll reevaluate her symptoms at the time and see if it's helped or just stayed the same. It's obviously not going to hurt her, and then we'll make a decision if we're going to alter any sort of her medications from there, and if there are any other treatment options that we'll work with our veterinarian on. So Edie's 9,000 pounds, and then we have Tonka, who's 14,500 pounds, so it is a lot of weight. So we want to make sure that their feet are in good shape. So we call it footwork, but it's really essentially an elephant pedicure. So they have the pad on the bottom of their foot that will keep trimmed down. It grows just sort of like your fingernails, plus they do have nails on the fronts of their toes. So we don't want the nails to be longer than the pad. So we definitely file the nails with a rasp and keep them up longer, keep them up higher than the pads. Working on any number of behaviors, at least every day we're training the elephants. It doesn't take much for them to pick up on new behaviors.